All right, let's just jump right in. Today, we're talking about something that's, absolutely essential for anyone in advanced therapy development, the integrated regulatory strategy. We're going to explore why getting this right is so much more than just ticking a box on some plan. Okay, so right off the bat, let's clear up a really common and honestly pretty costly mistake. People hear regulatory strategy and they think it's the same as a regulatory plan. It's not. A plan is usually the single, siloed document, kind of like a checklist. But an integrated strategy, well, that's a whole different animal. It's a comprehensive, unified approach that actually connects all the moving parts. And this is the big one. I want this quote to just stick in your head. Why? Because confusing these two things can lead to some huge misses down the line. An integrated regulatory strategy, what we'll call an IRS, is the solution. And remember our theme here. It's more than a plan. So if it's not just a plan, then what is it? Let's actually break down what an integrated regulatory strategy is all about and how it helps us move from just a bunch of separate documents to one single powerful vision. Here we go. This is the core of it. An IRS is really the compilation and synthesis, basically the bringing together of a bunch of different plans into one cohesive strategy. But the most important part is that last phrase, aligned with overall business goals. That tells you this isn't some separate regulatory thing happening in a corner. It's woven right into the fabric of the entire business. So what are we talking about here? What are these different plans? Think of them like puzzle pieces. You've got your quality system plan, you've got your reimbursement strategy, and that includes stuff like health technology assessments or HTA. You've got plans for your strategic partnerships, and of course, IP and product development. An IRS doesn't get rid of these, it just pulls them all together, making sure they're all working in harmony toward the same end goal. And why is this so critical right now, especially as we look toward 2025 and beyond? Well, the game has totally changed. We're not just buying raw materials from some simple supplier anymore. The future is all about these complex, deeply integrated partnerships. And that just requires a whole new way of thinking strategically. And that raises a really good question, one we should probably unpack. What is the real difference between a traditional supplier and a true partner in this new landscape? Getting this distinction is totally key to understanding why we need an IRS in the first place. So this table breaks it down perfectly. A supplier relationship, it's transactional. You order something, they send it, done. But a partnership, that's integrated. You're actually co-developing something complex, like maybe combining a device with a cell therapy. You're blending different company cultures, different ways of working. The complexity level is just so much higher. A simple plan just isn't going to cut it. Okay, so how do we actually manage all this new complexity? Well, it comes down to focusing on three critical pillars of integration. These are the absolute core functions that have to be connected right from the very beginning. And let me tell you, the stakes for getting this wrong are sky high. Can you just imagine? You get all the way to a phase 3 trial, and then you find out you don't have a patent in a key country. By then, it's way too late. It's an absolute disaster that sends you right back to the drawing board. This is exactly the kind of nightmare scenario an integrated strategy helps you avoid. So here they are, the three pillars we have to connect: strategic partnerships, intellectual property, and market reimbursement. And the key thing to get is that these aren't separate steps you do one after the other. No way. They're a continuous loop. A decision you make in one area immediately impacts all the others. Let's just take reimbursement as an example of how this loop works. If you start thinking about the cost of your therapy and how you'll get paid for it from day one, well, that creates this massive ripple effect. It's going to influence which partners you can even afford to work with, where in the world you decide to launch, and even how you design the final product for different markets. These conversations have to happen upfront, not as some afterthought when it's too late. Okay, so we've kind of defined the problem, and we've laid out the solution. So now let's talk about the payoff. What's the real, tangible, strategic advantage you get when you actually put a solid integrated regulatory strategy in place? So what does this all boil down to for you and your team on the ground? What's the real-world result of taking all these different plans and weaving them into one single cohesive strategy? Well, the benefits are pretty clear, and they're powerful. You end up having much better conversations with regulators like the FDA and EMA because your story makes sense and it's consistent. Your development process gets streamlined, you avoid those catastrophic misses we talked about earlier. And, the most important one, you get these vital therapies to patients faster. And this chart really says it all. An IRS boosts regulator confidence because you're presenting a clear, coherent vision. It drives up your development efficiency by connecting everything. And that, of course, increases your speed to market. It's a win-win-win. And really, when you strip everything else away, it all comes down to this number: 1. We're talking about one team working with one cohesive strategy, all driving toward one single unifying mission, getting these life-changing therapies to the patients who are desperately waiting for them. And that, right there, is the ultimate power of an integrated strategy.
So I'll just leave you with this one final thought to take back to your teams. In this world of growing complexity and deep partnerships, is your regulatory approach just a plan? Or is it a true strategy, one that's actually ready for the future?